Joanne, you're going to want to start over here. Your line is muted.
Thanks. Sorry, it wasn't letting me unmute. So greetings, everyone, and thanks so much for joining us. I'm Joanne Carter, Executive Director of Results, and I'm so grateful to be with you all and very excited that we're going to have a chance to hear from an amazing champion from Tanzania about why our advocacy campaigns on immunization and nutrition are so important in solidarity with low-income countries and communities to reach the most marginalized children and women with life-saving interventions. But first, I want to take a few moments to talk about how we're growing our community of change. And as many of you know, we launched our year-long Community of Change campaign in January. And that was really to focus our powerful network on strengthening and expanding the community of volunteers, partners, and allies, uniting behind the goal of a world without poverty and the oppression that causes it. Because the strength of our community, it truly is going to determine our ability to drive bold progress on every one of our issues. And frankly, in this challenging time, also our ability to protect the gains that we've made and to not lose ground. And my colleague Alicia is going to speak more to this later, but I do really want to thank everyone who's engaged in outreach to new volunteers, and especially a huge welcome to those of you who are here for the first time. We really need you and we welcome you. You know, election years, and especially this one, tend to worsen divisions, drown out critical issues, and exploit others for partisan gain. But we also know that election years can be powerful opportunities for organizing. So let's keep using this momentum to connect with our communities, because outreach builds our collective advocacy power. You know, and just one piece related to that, it's really fantastic that almost a quarter of your lobby meetings this year so far have included brand new volunteers. And that means that congressional offices are hearing from more advocates representing a diverse set of lived experiences. And we know how much meetings with members of Congress and their staff matter. Those are the moments when we bring more lawmakers into our community of change as allies and hopefully as champions. And since the beginning of the year, y'all have had over 130 meetings with aides or members of Congress, which is great. But I also ask you to please keep pushing for these meetings through this month, because you are the voice about why expanding and protecting SNAP and international maternal and child health and all of our other issues matter and are top priorities for their constituents. You know, just one example, we are deep, and many of you, as I know, are deep in advocacy on our appropriations for our international issues for fiscal year 2025. And this appropriations process determines U.S. annual funding priorities, but most grassroots groups stay away from it because of its complexity. But the way that you engage gives us such a powerful and unique impact. And, you know, this year there were really short timelines in the House for members to sign on to letters calling for bold action in our global appropriations priorities. And yet, even with that short timeline, we did amazingly well on those letters, you know, getting bipartisan support even in this divisive time, and getting more signers than ever for some of our issues. And that never could have happened if you hadn't already built relationships with members and their staff, been educating them, and making them allies. So thank you for your unwavering commitment and work. I'm also really excited for the momentum that this weekend's fellowship conference is going to add to this wave of advocacy. The Results Organizing and Advocacy Fellowship supports a cohort of amazing young leaders in our network to come together to grow their advocacy skills. And right now, they're literally coming together here in DC to strengthen their connections, deepen their knowledge, and take to Capitol Hill. And as I understand it, they have like 40 meetings already scheduled for DC, but if you also count like in district meetings, it's almost 80 meetings scheduled. So really amazing leadership. And their voice is going to play a powerful role in the impact we're creating right now for SNAP funding, for affordable housing, for fully funding international maternal and child health accounts that support vital primary healthcare services for families who may never have had access. And for a campaign for Gavi, the Vaccine Alliance, which is a global partnership that supported low-income countries to vaccinate over 1 billion children. And as Gavi seeks a replenishment of its funding this year to support groundbreaking new vaccines, but also to make sure that basic vaccines reach every child, US leadership and funding will be critical. Because we know even beautiful technology and tools do not guarantee that everyone benefits unless we make equitable access a political priority. And if the US government makes a bold pledge to Gavi and also robustly funds other maternal and child health efforts, we really can set an example for other donors and also stand in solidarity with countries and communities in ending these preventable deaths. And again, you really are the ones bringing this to your lawmakers and also to the media. So big shout out to our Results DC Maryland group that recently held a meeting with the Baltimore Sun editorial board. Kudos to you. And central to that conversation with the Sun's editorial board and to our larger conversation of global child survival is our very special guest today, Dr. Teo Masenge, who is a renowned pediatrician from Tanzania. So Dr. Teo, thank you so much for engaging on a whirlwind US advocacy tour alongside many results groups. And we are so honored to have you join us today from Austin, Texas. I'm now going to hand it over to my colleague, Dorothy Monza, to give Dr. Teo a more thorough introduction and really allow for a great conversation. So Dorothy, over to you. Thanks, everyone.
Amazing. Thank you so much, Joanne. And hello, everyone. My name is Dorothy Monza. I am the manager for global nutrition and child health policy. So I have the privilege of leading up a lot of our global policy work on these issues and working closely with you all, but also our partners in the US and around the world. So really excited to introduce Dr. Teo, who is a highly experienced pediatrician with more than 15 years of expertise in child health service delivery. And she's deeply committed to improving the quality of care for children and ensuring their well-being across Tanzania and the world. So I'm very excited to be able to hear from you. And Dr. Masenge serves as the chairperson of the National Pediatric Technical Working Group and as vice president of the Pediatric Association of Tanzania. And she plays a pivotal role in providing technical assistance to government ministries and partners in order to make sure that these important initiatives like vaccination and early childhood development are reaching all the kids and communities who can benefit from them. Dr. Masenge is the Chief of Party for the Comprehensive Child-Centered Care and Services Project at the Christian Social Services Commission, where she also provides leadership and guidance on delivering these life-saving programs. As a pediatrician and a mother of two, Dr. Masenge knows firsthand how important this work is, both professionally and personally. And I've already had the privilege of talking with Dr. Teo a bit in advance, and I'm really grateful that you all are going to get a chance to hear some of her amazing work as well. So, Dr. Teo, thank you so much. And I'd love to start off by just hearing a bit more about you. Could you tell us, how did you first become interested in being a doctor, and how did your advocacy work grow out of that?
Yeah, so thank you so much for giving me this opportunity to share my story and coming here all the way to kind of share a first-hand information from country that is really supported by Gavi to reach so many children who are vulnerable and save a lot of lives. Yeah, so I have a lot of things that really were my turning point to become a doctor, but I will talk a bit on what inspired me to be a pediatrician and to be like a global health kind of an advocate to make sure that all over the world, life of every child matters and governments are taking accountability and responsibilities to invest in health programs that support child health. So when I finished my MD, I was posted to a district hospital, and fortunately, I was the only MD in the pediatric ward, and that was an epidemic. That was an measles outbreak by then, and unfortunately, I was not vaccinated because I was born 2 years after the introduction of expanded program for immunization in our country. And my mom gave birth at home, and there were no complications. And so my parents were kind of happy that they no longer have to go to the hospital because I have no problem. And so I didn't receive the childhood immunization. And the only thing that I got was 6 months later, I received the BCG. And from thereafter, no other vaccination, nothing. And even my card is quite empty. Even the weight monitoring was not there. And I didn't know that. And so during the outbreak, I was saving the patients as if I'm full immune to measles, because I was expecting I must be vaccinated, because this has been like 2 years after introduction of the vaccine, and I must be vaccinated. There's no way I'm not. And so I got sick, and by that time I had a 6-month-old baby. I was breastfeeding, and also my child got measles. And in our country, the vaccination for measles is around when the child is 9 months. And so at 6 months, it was not a way that I could have get her to be vaccinated. So that was a terrible, terrible, terrible experience to feel I got sick and my child is sick, and I was the only doctor saving patients. So they have to call other doctors from other departments to come and support me, because I'm the doctor and all the attention was around me. And I felt so bad that a lot of children at that particular outbreak lost their life because they couldn't have my support as a doctor. And yeah, so from that particular moment, I felt how patients will feel. I felt how the mommies will feel when their kids are quite sick and they can't do anything about it. And I said, from this particular moment, I want to be a pediatrician. I want to be a child health specialist. I want to be the voice for the voiceless. I do not want to see a mom going through what I went through, when there is something that you can do and kind of protect all these problems in our communities and the things that we can do to support and save lives. So that's how I became a champion, and really I'm very energetic and excited to move forward to kind of making sure that we have so many people like me who can talk about investing in child health and saving life around the globe. Yeah.
Amazing. Thank you, Dr. Teo. And I'm so glad that you and your child were okay, and that, that was able to be the catalyst for your amazing work as an advocate and as a pediatrician. Over the past 20 years, a number of new vaccines have been developed. I know you mentioned you were just kind of born right as the measles vaccine was becoming popular. And one that comes to mind, kind of that I've heard of a lot in my career as an immunization advocate, is the rotavirus vaccine. Every year, hundreds of thousands of kids die from diarrhea and dehydration. And rotavirus is a virus that causes some of the most severe strains of deadly diarrhea. So I'm wondering if you could tell us a bit about what changes that you've seen at your hospital and in your community over the past 10 to 20 years as these new vaccines have become available. To Joanne's point, we can have scientific breakthroughs, but how is it really reaching the community and being felt and implemented there? So I'd love to hear your experience of that.
Yeah, so thank you so much, Dorothy, for that question. And that really brings me to the top 3 causes of death in our community. By the year 2000, And up until I think 2020, the most common causes of death were three things. One was rotavirus diarrhea, two was pneumococcal pneumonia, and three were malaria. And we also had some outbreaks for meningococcal meningitis. So these were the deadly diseases that we were like every day seeing them. But talking about the rotavirus diarrhea, it was like if you have like 10 children coming in for consultation, almost 8 or 9 of them will be due to severe dehydration and shock because of rotavirus diarrhea. And rotavirus diarrhea kind of like the span by the time that you get infection, by the time that you present with the symptoms, and rapidly go to severe dehydration and rapidly go to shock. So that was like in a day you will have like 3, 4, 5 deaths due to severe dehydration, because before you resuscitate this particular child, the other one is already in shock, the other one is, and you have a full ward and a very few number of doctors. So it was very terrible. And especially in our hospital, for example, we had to kind of open a ward and call it diarrhea ward, because like everyone was coming in surge with severe dehydration and diarrhea. And when you do the stool analysis, you find out that mostly were due to rotavirus. And so we were happy that the rotavirus vaccine came in, despite a lot of intervention that we were doing around that time by introducing oral rehydration therapy, introducing zinc and all that, but it was not possible to kind of prevent the severe form of diarrhea that they were having and dehydration. So back in 2013, there was 3 things that were happening after kind of like 10 years of advocacy and WHO supporting us to kind of talk to our governments. And Gavi was around that time also supporting African countries to roll out pentavalent. And so we got lucky that pentavalent came hand in hand with introduction of rotavirus. And from that particular moment, we went to the first the high-rank politician in our country, who was the president and the first lady, and they took it to heart, and we were able to kind of roll out pentavalent, and we were able to roll out rotavirus vaccine. And I will say even 3 years down the line, the under 5 mortality went down. We were talking about 112 deaths per 1,000 live births. And 3 years later, it went to, 10 years later, it went to 81. And then 2 years later, it went to 50, it was around 51, 53. And as we speak now, we are talking about 43 for the under 5. And even the infant mortality rate has gone down. So we are seeing a big change when we compare to the number of patients that we are surging in during the time when we did not have pentavalent, and during the time where we did not have rotavirus vaccine. But right now, really, we have closed our pediatric wards. We call it infectious ward, because like we no longer have children who are coming in with severe dehydration or shock due to rotavirus. The OPD kind of attendance has gone down by 75%. And I will tell you, through my 20 years experience with child health, it has become like, it's the most powerful intervention that I've ever seen to save life to that extent.
Wow, that is such a powerful story. Thank you, Dr. Teo. And I think it's really, for me, just so awe-inspiring and important to hear your firsthand experience of, in one person's career as a doctor, this amazing change has been able to happen. And you're nowhere near being at the end of your career. So
yeah.
I know there has been amazing progress and a little bit you know, we did lose some progress and are experiencing some backsliding after COVID-19. And we know there's still some communities that are missing out on these really important health services. And one area that we really are working to elevate and raise awareness of as results is zero-dose children. And those are children who haven't gotten normally even the most basic vaccines. So I was wondering, in your experience in Tanzania, what challenges do you see in getting to zero-dose children? What's working to reach those children? And is there anything to share on why immunization is especially important for these communities that might be further away from healthcare clinics?
Yeah, thank you, Dorothy, for the question. I'm a positive person, so I'm going to start with at least some strength that has helped us make this big progress. One is the political commitment to kind of support vaccination and immunization in our country. And even our Ministry of Health has formed a specific department. We call it Immunization and Vaccine Development Department. This is really a department that just deals with the issues of vaccination and immunization around the country, trying to bring in national and international stakeholders to kind of support the rollout and the maintenance of the vaccines in the country, and making sure that we address all the issues around vaccination. So one is the political commitment, and the good thing about the political commitments are the ones who kind of allocate budgets, they pass the budget and everything. And so for us, it has been a good way of making things move. And as a child health specialist, we are kind of connected to the reproductive health, maternal, newborn, and child health department, where we kind of have a direct access to the Minister of Health, and sometimes we have direct access to the president, because we are like the professional association. We work like an independent. We are not government owned, and so we kind of have direct access to the president, and we'll go there and talk about child health investment, and we'll talk about the issues around vaccination and saving life. So, and they have been good at listening to us. It's just that we don't have so many people who are willing to come out and talk about the issues. And so seeing you guys, you have a lot of people who are really want to come up and talk about it. It's very inspiring, and I'm so happy that I'm among you, and I would like to really bring some more people to talk about it. So that was the major strength. But another area is the use of community health workers. For so many years, we've been having community health workers that were supported by programs that are not like government funded. And through them, we've been able to bridge the gap between the health facilities and the community. And they kind of be trusted by the community because they speak the same language, they live in the same environment, and they can talk the language that the community understands. You know, when you're a doctor, you talk a lot of the science and everything, but the community health workers will talk to a level where the community really understands them, and they feel like you are among us, and if you are saying this, I will trust you. So these are the two things that I will say they were really key. And also the community awareness that we create through social media, through radio and TV, and even community events. This has been key to kind of address the myth around vaccination and all that, and also forming community champions that will really take that into the hard to reach areas. But we still have some gaps. Among the gaps is around zero dose, as you said. Unfortunately, before COVID, the zero dose was around 2% in our country. But then the survey came out last year, and it is showing that zero dose has gone up to 4%. And this is scary because around like in our nearby countries, we have had some outbreaks of measles and polio, and this is like we really needed to go back and see who is not vaccinated and all that. And last year and this year, we've had a lot of community campaigns to revaccinate, boost doses for under 5. And I'm not sure how far we've been able to kind of support the communities, but I think we have reached some of them, but not all of them, because we have a lot of issues around infrastructures to kind of have all the dispensaries and health centers be able to deliver or to kind of get the shots to the community. And so we really need support around outreach programs for the health facilities to go out in the community and deliver the shots, because we can't say that we be able to have everyone coming to the facility as due to poverty issues, they do not have transport access and all that. And so I believe in a way, through the outreach programs and the use of the community health workers, we'll be able somehow to address the 0 dose. But yeah, that's our big gap. However, around malaria vaccination, Tanzania is among the top 4 countries that have contributing to the burden, to the death of children due to malaria. And we are not among the first countries that are rolling out malaria vaccine. And so we are looking forward to the future years to roll out. And so we kind of looking forward what Gavi is going to offer us and what the country is going to invest to make sure that bit by bit we'll be able to kind of independently roll out and support the lives of children who are really in need. So those are the big things that I would say right now are our gaps, and we are looking forward to kind of work together with different stakeholders to address them.
Amazing. And I'm similarly an optimistic person, Dr. Teo, but talking with you makes me feel even more optimistic and hopeful about what we are going to be able to accomplish together. There's one question that I want to raise from the chat from volunteer Florence. Florence visited Tanzania briefly in 2023 and was struck by the difference in the medical facilities between urban and rural areas. Could you address that? And are there particular, differences or challenges for the rural populations to be accessing healthcare services?
Yeah, actually, if you look at our neonatal mortality, they are more higher in the urban areas as compared to the rural areas. And this is because most of the rural facilities do not have kind of being supported to be able to provide specialized services. And most they are concentrated in the urban areas because we already have even the private clinics set in the urban areas. And so it's a big issue to be attended when you are living in the rural area. And people will strive to get to the urban area, and unfortunately, the transportation system is not that much stable. Some roads are not passable throughout the year. We have disconnection between a district and a district, between a village and a village, and so access to the health facilities is difficult. But even the services that are available in the rural area facilities are not to that much extent that will cover comprehensively services that are needed for a particular patient. So that will be the big difference. And thankful to our government from last year, from 2022, actually, the president has came out and say, this is the time where we want to be on track to reach the SDG. And they invested so much on the infrastructure, the district hospitals, to make sure that they're on track on the universal health coverage, and also improving the primary health facilities because they've been neglected for so many years. And 80% of our population lives in the rural area. So they have access to the building and not access to the service. That's the big change. And right now we need to have access to services and not to the building, because the health facilities were run by medical assistants, they are run by public health nurses, and not really the health practitioner that you like to be there to address issues of the patients who are coming in with communicable and non-communicable diseases. So that has been a really a step forward. And as I speak this week, from this week, also there is this thing that we call is called like our president is called Samia Suluhu Hassan, and so there is this movement called Samia Suluhu Hassan Medical Specialist Camps. So it's like drawing medical specialists from the urban hospitals and take them to the rural facilities to kind of support, identify, treat, and make referrals where possible for diseases that they are not be able to treat them at the district or from the primary health facility. So it's a big and huge thing to access the rural and communities. So it's like a campaign to make them come forward if you have anything that you need to be like attended. And if we can't attend it here, we will refer you to a facility, and also we get transport to take you there. Yeah.
Amazing. That sounds, there are a lot of parts of some of what you were saying that I think would resonate for people here in the US in terms of rural healthcare and being able to access care. So thank you so much for elaborating on that. There is one question, and this is going to be our last question before we transition to some campaign updates. But this one is coming from Leslie. Is Tanzania rolling out, or have you rolled out the HPV vaccine? And what age are children getting that vaccine?
Okay, good question. Yes, so Tanzania had rolled out HPV vaccine back in 2019, but that was the 2-dose kind of vaccine. And it has been being so slowly rolled out because we had a lot of myth and we could not do a lot of campaigns to kind of recommend that. And right now, 3 weeks ago, the single-dose HPV vaccine was rolled out. And at this particular moment, we are able really to come out and do a lot of community campaigns, social media campaigns, and the political leaders like our Minister of Health and the President came out and talked about it. And so we have seen a big mass bringing their kids for vaccination. And even our Minister of Health had 2 daughters, and she came out and say, hey, I've been able to vaccinate my 2 daughters with HPV vaccine. So people had to come and kind of say, okay, if the minister is doing this, I believe this is something that is safe. I will do it for my daughters. And so like all the schools now are kind of are supported to kind of do the vaccination. Parents have been informed, and our target is to reach around 5 million girls 9 to 14 years. And I think by now they've already reached like 50%, because like it is a big movement targeting the rest of the year to make sure that we reach the target, but also we reach even the vulnerable population in the very interior part of the country. Yeah, so we have rolled out, and I'm happy that we have the single dose, because for us it was a challenge. A girl will get 1 shot and will not come for the next shot. And so it was kind of first shot, and we missed a lot on the second dose. So right now we are happy that we are going to have just 1 shot and it's done.
That is amazing. And what an exciting and positive note to end on. So I want to thank you, Dr. Teo, for your time, your expertise, and just your openness and your warm heart. It's so amazing to hear from you on these issues. And I'm excited even more people get to hear from you before the tour is over.
Yeah.
Great. Thank you, Dr. Teo.
Thank you
Hello
so
to
much.
everyone in Austin back there. I will now do a brief campaigns update on our global campaigns. So as you all know, we are in the middle of an appropriations push for FY25, and this work is so important. As Joanne mentioned, it's not a lot of people are doing it, so it's extra important that we speak up here, but also because, you know, these are the line items that fund this really important work that USAID and Gavi are doing hand in hand with experts like Dr. Teo. So these are the asks that we have for our FY25 campaigns. I'm not going to read them all out right now, but we have all this information available on the website, on our appropriations memos, and also in our blog. So I'll be sure to drop a link to that if one of my colleagues doesn't beat me to it first. The House letters have all closed, and thank you so much for your quick work. That was a really tight turnaround, and having everyone get mobilized and be reaching out really made a difference there at the end. So stay tuned for the final numbers and updates on all of that. I know the maternal child health one off the top of my head because that's kind of my issue area, but all of the letters did well in such a strained environment where it's you know, not a given that members of Congress are going to get on the record for these issues. And so us really emphasizing the letters and then following up with their personal member requests really makes a big difference. These Senate letters are still open though, so be sure, thanks Lisa for putting the link to the blog. All the information that you need to take action on the Senate letters is there on the website. And we have, you know, a couple weeks to work these Senate ones, and reaching out now is good because then if we get a tight deadline like the House, then we can do a flurry of follow-up. But normally the earlier the better to hear from us so that we can make sure staff prioritize this for their bosses. Next slide, please. And I want to let you all know before I hand it over to Tashawn that we have some exciting bipartisan resolutions for Gavi in the works. So stay tuned in the coming weeks as myself and my colleagues are going to share about this new tool. You know, as appropriations is winding down, we're not giving up on getting members on the record in support of Gavi. So make sure you're signed up and registered for the national webinars and everything so that you can have all the info you need to take action on Gavi this summer and keep doing your important work. So I'll pass it over to Tashawn. Thanks.
Thank you, Dorothy. Next slide. So, how much we can get done in 1 month? There is a lot of work ahead of us, but in the month of April and the beginning of May, we've been able to do a lot in terms of outreach towards our U.S. poverty campaigns. Of course, while the child tax credit is still lingering in the Senate, we are not giving up on it at this time. We do want you all to continue to help us get that over the finish line as senators continue to have conversations about it. The next priority for us, of course, this week's both the House and Senate Ag committees released their framework for their particular farm bills. And while we will continue to oppose some of the harmful cuts to SNAP and other assistance programs, we are just at the very beginning of that fight. The House will mark up their bill later this month, and you'll see an action alert asking for you all to help protect the benefits that are given through SNAP. The proposal that was presented by House Ag Committee Chair Glenn Thompson is not something that will benefit all Americans. In fact, his proposal is to cut $30 billion from SNAP, and that will not do. And so we will continue to fight. So look out for more information on that as we get closer. And then last but certainly not least, for our housing actions, while the Supreme Court heard grants pass, this week, we are also looking at other Fair Housing Month items ahead of us. So look forward to that as we continue to move forward. Next slide. So here are your 2 key actions. The first is to continue to ask your senators to put the child tax credit bill on the floor. We know we have the support. We have to urge our Democratic senators to ask Leader Schumer to really put it on the floor within the next couple of weeks. And then for Republican senators to vote for it. And of course, once again, when you see the action alert for the Farm Bill and SNAP, please don't hesitate to take those actions, because it's very crucial to get our voices across. Next slide, please. And I am now handing it over to our expansion team. And for those that are celebrating today, may the 4th be with you.
Great. Thanks so much, Tashawn. And hi, everybody. I'm Amanda Beals, and I lead our global expansion team here at Results, and I'm joined by Alicia Stromberg, also on my team. And we are joining today for the grassroots section because this summer, our main advocacy goal is to strengthen our community of advocates. We are asking people to come together in person for powerful community action meetings that will get people in your community on the record in support of poverty solutions. And in a minute, we'll dive into the details. But before we do that, I want to talk about the importance of community and relationship in advocacy. As a grassroots movement, we strengthen our community by investing in relationships with each other, with new advocates, partners, and other action takers. And I know I don't have to convince you that in advocacy, relationships are key to influence and power, because we talk about it all the time with our work with members of Congress. That's the whole goal, is to strengthen those relationships. And the same is true for building power in our local groups and communities. We must be in relationship with each other to sustain ourselves and our groups. Relationships keep people connected when the advocacy gets frustrating. They encourage people to take action when our cynicism is high and our self-esteem is low. And we can also use relationship to call people to take on even more leadership when the need arises. And this really allows us all to connect on common values and also feel a sense of community. But it's not just important personally for our groups. Building community power right now is a critical part of our short and long-term advocacy campaign timeline. And you just heard from our policy team on the big things ahead and the key moments that we really need to be mobilizing on right now. As we wrap up our spring lobby campaign, the Senate still has not passed the child tax credit expansion. We continue to hear about threats to SNAP. Later this year, we need to convince Congress and the administration to invest in global child health. And next year, we have a new Congress that will take up even bigger fights. And as all of this is going on, soon our members of Congress and the administration will be turning their full attention to election year activities and their reelection. We can't let them leave the work undone this year. We can't let them leave the needs of our communities and people experiencing poverty behind while they're focusing on getting reelected in their own power. So by showing up in our communities at this moment, right now, raising our voices together, we will demonstrate that our community is willing to show up and get on the record in support of these really important solutions to poverty, and that we expect our members of Congress to show up and get on the record too. So our goals for coming together this summer, we need to strengthen our relationships with advocates in our groups. We need to build our power by engaging new people and partners. And we need to demonstrate that power to our elected officials by getting our community members on the record in support of these solutions to poverty. And through that, we'll feel connected, hopeful, and hopefully encouraged about the difference we can all make together. And all year, the expansion team, we have been working to build up a base of interested advocates in your communities through our recruitment work to help you make this moment successful. So I'm going to turn it over to Alicia to talk a little bit more about that.
So much, Amanda. And hello, everyone. My name is Alicia Stromberg, and I'm a manager on the expansion team here at Results. And it's great to be back again on the national webinar to talk about ways that we can grow our results movement and our community of advocates. So to share an update about how recruitment is going so far this year, we are absolutely feeling the buzz and energy stirred up from elections and our recruitment campaigns. We've heard from over 720 people since the beginning of January who have reached out to us wanting to learn more about volunteering and how to get involved in our recruitment campaigns. And we hear from more people every single day. And folks have come from all 50 states. So no matter where you are in the country, there are new people in your state who want to be contacted and want to learn how to get into action, which is super exciting. And we've had over 100 people who have attended an introductory webinar this year, and dozens have joined our volunteer network. And what we're noticing this year more than ever is that people are looking for community, inspiration, and connection out of their volunteer engagements. And I know many of you on this call have been working with us the last couple of years to establish connections with our online community and invite these people into action. Some of our warm leads work, if you know that term. And I just want to thank everyone for your partnership. I see the ways that you make an impact with new volunteers who are joining our network, and it is truly transformational. And I'm really excited to continue this work again this year. So I just want to invite everyone on the call to take a moment and reflect on when you first got involved in Results, which may have been earlier this year, a couple years ago, or maybe even 30 years ago. But I just want you to think about what got you to stick around and affirmed that there was a place for you in this organization and that you felt you could make an impact. And I bet if you think about it, it probably had something to do with another person in your group, a genuine interaction that you had with someone, maybe receiving support to take action or encouragement. I know what my moment is. And advocacy wouldn't happen without those relationships and that community. It is such a key component of organizing. We can do a lot together virtually, and we can be so powerful behind our computers, but there really is true power in investing in our relationships, and that will sustain our advocacy movement for years to come. So that's our intention this summer, is getting together, being in person together, facilitating meaningful relationships amongst our existing group members and hopefully new people too. And we know that showing up in person truly matters for building relationships and can catalyze new volunteers to take powerful action with us. So I'm really excited to invite Chelsea Lee from Lexington, Kentucky, who is a new volunteer who attended an outreach event with us earlier this year. She found us online a few months ago and has really just jumped into action since then. It has been truly exceptional to see Chelsea's growth as an advocate this year, and she's now working to mount our request with Senator Rand Paul's office, her senator in Kentucky. But I'm going to let her share more about that. So Chelsea, over to you.
Great, thank you. Hi everyone, my name is Chelsea Lee, and my original name is Chelsea Lee, and I am a results volunteer in Lexington, Kentucky, and it's an honor to share my experience at the national webinar today. I first signed up with results last year, but I didn't start volunteering actively until the beginning of this year. In February, I received an invitation from Erlen Gray to attend Community Partnership for Change event. This event was an opportunity to connect with others in the community who also wanted to make a difference. And it was held at Beaumont Presbyterian Church in Lexington on February the 13th. I am so grateful I attended this event where I met people from Results, Best Friends, and Church Women United. Erlen and Maureen each gave a presentation at that morning, and their speech showed me the work we do with Results has a significant impact touching the lives of many people. It was also inspiring to see people from all different groups came together with a shared goal to build a better community. After the event, Lisa and Pritika from South Central Regional Group reached out to me and provided their support for me to start. My first project involved contacting Central Paul's office to get his support for child tax credit approval. I remember feeling a mix of excitement and nervousness as it was my first step into the world of volunteering with results. As I started working, I quickly learned that my efforts, although seemingly small, were part of a much bigger picture. It wasn't just about making phone calls or sending emails. It was about building relationships, raising awareness, and contributing to a cause that was greater than myself. So I encourage everyone here to find their own way to contribute, whether it's through advocacy, direct service, or any other forms of engagement. You never know where it'll lead you. And thank you for giving me this opportunity to speak today. And I'm excited to continue my journey with you all.
Awesome. Thanks so much for that, Chelsea. I love that, your examples there. And just when I was listening to you, the reminders of some of those benefits and things we get out of being in person, in community with other people. And, you know, it's not. Sorry. Am I unmuted? Could you guys hear me? Oh my gosh. Yes, you could hear me. Okay, good. It's not just about taking online actions, but it's really being in community together, working towards that same vision and that feeling you get, especially as a new person coming in, and how powerful that can be. And just a reminder for people on the line, you know, new people coming in really over the last 4 years, we haven't had those kinds of opportunities like we used to do at Results, of coming together for community because of the disruptions we've had with COVID and being virtual and all of that stuff. And so we really want to help you take advantage of this moment now as a movement and support your community to come together to be in action. And so today, what we're doing is we're launching our On the Record community action campaign. And throughout June and early July, what we're asking is that all of our volunteers and groups plan in-person action activities where members of your group can come together, where you can invite new people to join you, new people who have come in over the last few years, new people who have come in over the last few months, and you can connect with other partners to really bring your community on the record in support of poverty solutions. So we're really asking groups to do 3 things. 1, commit to being together as a group with an in-person action gathering that's fun and meaningful to you. There is, this is not just for longtime advocates. You heard from Chelsea, we hear from new advocates all the time that they have never met another Results volunteer in person after being involved for months and sometimes even years. So don't underestimate the power of just doing that one thing this summer, coming together and making your relationships a priority. The second thing, once you have that on the calendar, you might as well invite new people to show up with you. You're already getting together. So we mentioned we've heard from over 700 people across the country this year. You know other people who care too. Let them know why it's important to prove that our communities care right now so that we can leverage our power for change this fall and beyond. And then 3, the third thing, think about where else you'll already be with people in the community. Where will you be with friends, with family, with other social groups, and see if you can incorporate an action into those places too. And I'll give you an example of that in a minute. We have some things to help you with this. First, we have a Results on the Record postcard action that you can bring to these activities with an action sheet you can use to help people write powerful messages. The postcards are engaging, they're colorful, they're easy to use and really bring into any kind of activity that you're doing. Your group can deliver your community messages on these postcards at upcoming congressional meetings. You can use them at election events, and you can mail them in as a follow-up to your lobby meetings that you've already had too. The second thing we have is the social media action that your group can take. Part of our goal this summer is to show our leaders that their communities are showing up to call for solutions to poverty. We also want to show new advocates and potential new advocates that we are the kind of people that are willing to show up too, and that we have a community here that they can be part of. So get together and take a picture while you're together so that we can showcase our community across the country. And we'll also have some social media actions you can use throughout the summer to mobilize your online network to take action and show up with you in community too. And we already have a wave of community action going. So we want to share what's already been happening. So you see that you're building onto something that's already started. This past weekend was my daughter's first birthday. In honor of the gratitude that I really strongly feel for this first happy and healthy year we've had together, I set up a postcard writing station at her party, and I asked my friends and family to take action to support our campaigns because we don't need anything for her first birthday. And I want to make sure that moms can celebrate and really have happy and healthy first years with their kids too, both here in our country and across the world. So at the party, 10 people took action. And you guys, the messages that people wrote were so personal and powerful. And I think it's because the event was so meaningful to me. When I was talking to people, I was able to bring out their meaning in their action taking too. So I'm sharing this as a reminder that you don't have to have a big formal event to mobilize people to action. So where else might you be getting together with people that a quick action like this could be meaningful to you and your people too? Some other things going on. This past weekend, results advocates from all over the Gulf South region came together in Orlando for their regional conference. They were inspired by Dr. Teo's talk and took collective action on child health together using the postcards. The groups also organized gatherings with medical professionals at a library and had 2 events with medical students at local universities. And through all of that, a total of 51 actions were taken as a result of those gatherings. And then finally, this past week, one of our fellows in Louisiana, Prashun, connected with 2 student groups that she's been part of to host Dr. Teo and engage medical students at her university with this action too. So what I want to remind people of is there's no one right size or kind of event or community action. Whether you're getting together one-on-one with a neighbor or friend, having a small group of friends over, or bringing together a formal group in your community, what matters most is that you're building connection through action. And there's time to make this happen. So we're talking about this summer. In May, it's only May right now, we're asking you to plan your community action activities. Think about what you want to accomplish and what you want to do. And then in June and early July, do them, do the things, get together, have fun, get your community on the record taking action. And so this way in the fall, you can leverage that power of community as we continue campaigns and put our members of Congress to task. So we want to help you get a head start on that planning. I'm going to turn it over to Alicia, who's going to get us started thinking through some ideas and inspiration, and also answer any questions that you guys might have.
Thank you so much for that, Amanda. So we've got some time now, folks, to just speak together, ask questions. Like Amanda said, I would love if anybody has done outreach or education action meetings in the past, if they want to share about what their experience was like bringing their community together and unique ideas you maybe had. Or even we can just brainstorm together on what would be meaningful or fun, or how can we do this in our communities. So I would definitely open the line. Feel free to put things in the chat or come right off mute. And we can have a big group discussion today and kind of start brainstorming together around this stuff. Looks like Colorado is coming together on June 15th. That's exciting. We would definitely love to help you fill that room, Andy. Does anyone have immediate questions about what we're doing, or things like that?
Hello, this is Brazil. Hi, I have a question. So right now we're just gonna we're reaching out to our community to how to get more support with joining results in our issues. Is that what we're going over with?
Yes,
you-
Amanda, do you wanna repeat your question?
Yes. Right now, right now, what we're doing now is like we're reaching out to our community about results, about people joining results, and to get like to help with our campaigns and stuff. Yes.
Yes,
Absolutely.
exactly. Yeah,
Okay.
exactly.
Yeah.
Yep, we
Okay.
want to do outreach in our community. We've got people who have reached out to us online who are primed to be doing outreach to. We can also invite other community members or community partners or folks that you have a relationship with that you think would maybe want to come take action. And we're asking them to come take action with us, and hopefully we can build a relationship with them, and then they will take action with us again down the line. So great
That's great.
question.
Thank you so much. Thank you.
Yeah. Anybody else have questions? Feel free to come off mute and share your name and share your question.
Hi, this is Willie Dickerson. I just wanted to say that we are in process of getting our congressman to come to a meeting at the library to share about his trip to South Africa. We actually did this once before with the same congressman when he had been to Rwanda. And so it's also a chance to do exactly what you're talking about. And I hope we have the postcards in time.
When is it happening?
Well, we're still in process of getting a date, so we're not sure.
Okay, let's chat and make sure you get what you need to make that successful with the postcards.
Thank you, and thank you both for doing such an inspiring job.
Same to you, Willie.
Every group is going to be receiving postcards, and they should be coming within the next couple of weeks. So keep your eyes on your mailbox.
Go ahead, Lynn.
Well, that was going to be my question. How soon? So one of the things that I had luck with on the CTC, I'm now a retired school teacher, and there's about 30 of us who text message each other and pick one Monday a month that we have lunch together. And so it's not all 30 come, it's usually around 10 to 15. But we were in the middle of our results campaign about pushing the CTC in the House. So I just made out a little action sheet, really simple for them, and said, and just, you know, at the luncheon said, I know we all had students, because we worked at Title I schools. I know we all had students that we saw, you know, had families that struggled. Would anybody mind taking this little tiny phone script and just calling the congressman and saying your name and that you want this to happen? You know, that he supports the CTC. And 9 of the 10 people who were there that day took it and made calls, and some of them got really jazzed that, you know, they were doing, you know, something, and a couple of them have been asking me since, like, what else can I do? So, and that was just a group I already belonged to, which I think you listed as one possibility. Look for things you're already doing and ask those people. And it was easy. And postcards would make it even easier, because I had to make them a little phone script. That was harder.
Yeah, I love that example, Lynn. And it's just like, I think sometimes when we think about outreach and connecting in the community, we can get one idea of what that looks like, which is, oh, we have to find a space and invite lots of people to come here. But like, it can be as simple as thinking about who we're already connected with. It's likely that people we're already connected with share our values and share the kind of, you know, future that we want to see together, and giving them an opportunity to be in action. So I really identified with some of them were really jazzed when they took to action, because that's how the people at my daughter's birthday party were too. And they talked about how cool it was to be able to do something meaningful that they don't normally do day to day. So thanks so much for that great example. What other ideas do people have, or questions do you have that we can help you with as you're thinking about how to get your communities on the record this summer? Go ahead, Beth.
I put it in the chat, but I just want to say that we're planning on having a big summer barbecue in the front yard. We could put as many as 100 people out there and cook them hot dogs and hamburgers and veggie burgers. And our groups from are going to help do this. And I think of it as a fundraiser. That's how I started thinking about it. But to me, it's actually a fundraiser. Also, because many of us, including myself, came to Results because we went to a fundraiser first. And so to me, this is a way to bring people together to hear.
I love that idea, Beth, because when you were talking about it, I was like, I'm going to go to that. That sounds fun, and that's part of the challenge right now too. I think with getting out of the house and connecting is like a lot of people just aren't used to it anymore. And you have to think about like, what would actually make me want to get dressed and leave my house today? And when I thought about a barbecue in your front yard, I was like, sign me up. I want to be there. So that's part of this too, is thinking about what kinds of things are meaningful or fun for you or your group that you would actually look forward to. You can build relationship that way and hopefully convince other people that it is worthwhile to leave the house sometimes.
Amanda, you're invited.
Count me in. What else? What else are people thinking about? This is great. I love this.
Go
So
ahead,
this-
Eloise.
This is Eloise in Austin. So when we had redistricting, all of us on our team ended up with the same member of Congress. But all around us are other districts. So I think I'd like to try to do some outreach that will bring in volunteers that are constituents in the adjacent districts to Austin.
Woo-woo. That's a great idea. And the other the thing I like so much about that, but it's so meaningful to you. Like you can just tell when you're talking about it, how meaningful it would be and to be able to expand and build power in those other places. And so I think that's a great way to go.
Other questions or ideas, Amanda?
Yeah, I was going to ask if anyone's been inspired by what someone else has shared and is now thinking of something you want to do in your community too.
Is it fair for me to go again while everybody else is thinking? The idea that I saw in the chat about the park and also Beth's idea about a barbecue. My family actually puts on an art festival. It's gotten to be pretty big. This is the 12th annual, and it's kind of fancy, but I know they have one little corner of the park that they were trying to figure out what to put there. Maybe I could put up a table and do postcards. I will ask, I have to get permission from my mom, but I will ask to see if they might let me do that, even though it's an art focused festival. A lot of community people show up there, and that would be a great way to get lots of involvement.
Absolutely. Oh, go ahead.
Yeah, Brazil.
Yeah, hi, Lynn. This is Brazil. Hi. I am hearing what you were saying. I would love to I'm hearing like different ideas about like barbecues and stuff to get people to cook to be in Results. I would like to maybe we can talk about this later, about our group. Maybe we can come up with some idea to, like you said your family's doing art festival, and we can probably do like a barbecue too or something, or just give ways, because I'm the outreach coordinator, so I wanted to invite people anyway to Results. So yeah.
Well, excellent, everyone. Thank you so much for participating in that brainstorm. This is not the last opportunity that we're going to have to talk together about this and, continue to support each other, to be creative and to show up in our communities together. So I've already got some ideas buzzing on how we're going to be doing this in states that I'll be supporting this summer. So now I just want to take a couple of minutes and show you some of the resources that we've put together to support you all to do this campaign. So I am on the Results website right now, and this is our Community of Change campaign landing page. I'm sure some of you have probably visited this page before this year. We are going to be using this all year to kind of collect all of our resources and things related to the Community of Change campaign. So where I'm going to go is I'm going to scroll down to this yellow section of the website that's called Grow the Number of Advocates in our community of change. This is where we're going to put all things outreach and community action this year. So if you open up these outreach resources, you can see that we've got resources relating to planning your action, communications resources, and our solidarity actions as well. So the first resource that we have is this how-to. This is basically everything that we went over today, what we're doing, how we're going to do it, the timeline of what to expect, and then the resources that you've got at your fingertips to help you to do this. So this is a great place to start when you take the next steps and want to, start working on your action. The next resource we have is an action sheet. Y'all are familiar with these. We do these all the time. This is an action sheet meant to guide you and the attendees or anybody that you do the postcard action with, and how to do that and how to be effective. So there's some fast facts that people can use. And then there's also a formula on how to take action and some prompts for writing your postcard. So this is meant to be printed out and you can bring it with you to your community actions or to your, to the coffee shop or to the barbecues or to your birthday parties, wherever you are going to be showing up with results this year. So the next thing that we've got is our inspiration guide. This is meant to guide you in your planning when you get together with your groups to start to hatch up some ideas. A lot of the questions that we just went through within our group discussions show up here. So this is meant to, kind of help you and your group kind of figure out and percolate on some ideas and get the juices flowing on how you could do your outreach this year. The next resource we have is an invitation toolkit. A lot of you have used invite toolkits with us the last couple of years to do outreach to our warm leads and our online action takers, inviting them to attend lobby meetings or attend regional conferences. This is a very similar toolkit. We have email templates, text messages to invite people to your event, and then a phone call script and a voicemail script. We know that calling people is one of the most effective ways that we can get in touch and start to build those connections with folks. Even if it means you're only calling 5 people collectively as a group, that is still meaningful outreach, and I encourage you to take the time to do that. We have a sample flyer for you. This will download as a Word document, so you can customize it to use for your specific event or action or whatever you decide to do. And then we also have a social media guide, which I'm really excited about. I'm so excited that we're going to start to use social media to amplify our advocacy. So there's some how-tos and nuts and bolts information about how to maximize social media, and then sample social media posts for you to do before and after your action, as well as some information on what kinds of content to collect during your action, because we want to take fun pictures, show people getting on the record, and then put that online, tag our members of Congress, and really show our online communities that we're going to be in action. And then invite our online communities to take action with us by sharing the solidarity action. So that's a lot of resources. I encourage you all to visit the Community of Change page after this webinar, familiarize yourself with everything we have, and start to use it as you plan again in May. So to wrap this section up, I just want to share with you a couple other support and webinars that we've got to help you all do this. So we have a week of drop-in coaching happening the week of May 20th. We've got 4 sessions happening. Sign up for a session, get some one-on-one time with staff, really can brainstorm and get some plans together for your community action. I invite you to come that week. We've got 2 webinars happening next week related to this work. First is the community partnership training. This is a workshop on how to find local partners, connect with them, and explore opportunities to work together. So that one will be super, super fun and a great way to build your relationships in your community. And then the next one is on Wednesday, May 8th at 7 p.m. Eastern Time. It's the Outreach and Partnership Coordinator meeting that we're opening to the entire Grassroots Network. It's going to be a brainstorming and planning workshop for how to do community actions and make it happen. So all are welcome. We'd love to see you, and the RSVPs are linked on the slide. And as we mentioned, every single results group is going to receive their postcards this month. So group leaders, keep your eyes out on your mailboxes. And I encourage everyone to just start to make your plans after this meeting, your next group meeting with results, talk about this stuff, start to think about what would be really fun for you and your group this summer and get out in the community. And if you have any questions at all, please reach out to me or my team. We would absolutely love to talk to you and support you to take action this summer with us. So thank you all for your time today. I'm stoked to do this work with you as always. And now I'm going to pass things over to my fabulous colleague, Sarah Leone, who's going to wrap up the webinar. So Sarah, over to you.
Wonderful. Thank you so much, Alicia. Can everybody hear me okay?
Yes, we can.
Awesome. Thank you. So we're going to go ahead and see how many amazing advocates we have with us here today. I'm going to go ahead and launch our attendance poll. So if you all wouldn't mind responding to this and just letting us know how many people are in the room today. All right, it is going. I see a lot of folks coming in, so we'll give this a few seconds for folks to respond. Oh, it looks like we have one group of advocates where there's 5 involved. That's exciting. We love when you all meet together for these national webinars and any webinars that we have that results related. So awesome. Keep them coming. We're getting there. And I see some of you are putting your attendance in the chat. That's okay too. Definitely answer the poll if it does launch up for you. All right, so we will keep this moving along. So we can go to the next slide. Just to recap what Joanne had mentioned at the beginning, and in addition to starting to plan for your convening meetings in June, let's finish up May with a strong lobbying push and continue to meet with as many offices that we can possibly cover. Our goal is 350, and I believe you all have met with about 104 offices. And I know since we took a screenshot of that poll yesterday, we've had lobby reports come in. So just again, keep up that great work. And if you do need support with requesting lobby prep, you can reach out to Katie Fleischer, and her information is on the screen. So we'll go ahead and continue on. Awesome. So please join us this coming Thursday, May 9th, to meet with your candidates for the Grassroots Director position. Thank you to everyone who submitted nominations to fill the open Grassroots Director seat on the results board. So on Thursday evening, you'll get to meet them for the first time. The current results Grassroots board members will host this town hall with the candidates that will also provide information about how and when to vote. The town hall is this Thursday, May 9th at 9 p.m. Eastern. There's no need to register. Just click the Zoom link in the slides, which will also be available in the weekly update. Next slide, please. So this spring, Results is urgently working to raise over $350,000 to amplify our work on behalf of the estimated 350 million children worldwide who face undernutrition. And 2 longtime Results volunteers have stepped up in a huge way to help us meet that goal. Thanks to a generous challenge match from Alan and Ellen Newberg of Washington State, your donation to Results will be tripled until we reach our goal. These 350 million children deserve not just to survive, but to be healthy and thriving and reaching their dreams and contributing to our aspirations for a better world. Will you step up in support of our children and triple your impact by making a special tax-deductible gift to Results today? You can find more information on the link on the screen, which you'll have available at the end of this call. Next slide, please. So on Tuesday, May 7th, please join our Community Partnerships to End Poverty webinar. Come gain an understanding and the essential role community partnerships play in organizing and advocacy. So on the webinar, you'll have time to map up community connections, create an action plan, and practice how to talk with community partners. So these are essential and valuable skills for growing the movement for the end of poverty. You can also register at the link in the slides and in the chat as well. Next slide. We wanted to highlight that we'll be having a special Gavi, the Vaccine Alliance Global Poverty Policy Forum this month. So we know that Gavi plays a critical role in helping vaccinate people around the world against deadly but preventable diseases. So Gavi is up for replenishment this year. And to help you understand what's at stake, please join us this Wednesday, May 15th at 2 p.m. Eastern. It will be recorded. You do need to register, but you can find that link in the slides, which you'll have available to you. And you can see through the ongoing slides, we have all the training and support and partnership calls that we have this month. I won't review each month, each one, but do please check them out. There's likely a training out there for you. And if I'm going too fast, remember that you can download from our website on the National Webinars page, and they will be available to you as well. And you can find all of our events on our website events calendar page on our website. It's actually, you don't have to click anywhere when you land on the website page. You just go straight up to the top to events. And then finally, the next Results National webinar will be Saturday, June 1st at 1 p.m. Eastern. As we kick off the June meeting campaign you heard about today, please join us to hear about how you can take action to protect the SNAP program in the next Farm Bill. And so last but certainly not least, may the 4th be with you. I know a lot of us are Star Wars fans here, so please enjoy this Saturday and do all things Star Wars. Again, thank you all so much for coming this afternoon and joining us from wherever you're joining us from. We really appreciate all that you continue to do. So with that, you can go ahead and unmute yourselves and we'll unmute the lines, but please go ahead and say your well wishes to one another, and we'll see you next month. Thank you, everybody.
Bye,
May the
everybody.
fourth be with you.
Everybody.
Happy Mother's
Bye,
Day.
temprano.
May the fourth be with you.
Bye, Thursday.
Bye, Lynn.
Bye, y'all. Have a great night.
Thank you, Dr. Theo.
Thank you, Dr. Theo.
Thank you.
Thank you very much, Dr. Theo.
Thanks, everyone.
Oh my gosh, it was awesome.
Great to be with you. Oh my gosh, it was awesome.
You guys are inspiring.
Bye, y'all.
Hey, Joanne.
Bye, bye.
Bye-bye, Joanne.
Bye.
Bye, Andy.
Have a great weekend, everyone.
Oh, look, there's Charles.
Yeah.
Charles.